What am I first doing? Or maybe I shouldn't ask questions? Well, I'm just going to. Coming in, I'm saying, hi Jenna, I'm Julie. I'm your nurse for today. How are you doing?
I'm good. How are you?
Good. I'm going to close the door for privacy. I'm going to verify your name and date of birth. Can you give me your name and date of birth?
Jenna Rondorf, 62104.
62104 matches. Great. I'm going to wash my hands, do some hand hygiene. We've provided privacy. We're all good. She's in a position where I can do everything. So Jenna, today I'm going to grab a chair because some things I'm going to do, I'm going to be sitting by you. But the plan for today is we're going to do an assessment of your head, eyes, nose, throat, and then kind of look over your musculoskeletal system, okay? It'll be about 20 minutes if we're lucky. Okay, good. You let me know if you need a break at all. I'm going to start by telling you 3 words. And then at the end, we're going to see if we can remember those 3 words. You and me both. And I don't have a pencil, so somebody's going to have to write it down. We're going to say jacket, swimsuit, banana. Okay? Jacket, swimsuit, banana. Okay, good, good. Can you tell me why you're here today? Or where you are?
I'm at school.
Okay. And what are you doing at school? What's the date or the season today?
It's winter.
Okay, good. And you're here for what purpose?
Nursing skills class.
Okay, sounds good. So we can check alert and oriented too, but mostly we're just checking the memory with that. So, we're gonna first take a look, right, because we always inspect. So we're looking at Jenna's head, and I'm looking at, does her head look normal cephalic? Does the head the right size? Does it match with her body? Is everything symmetrical? So we've got her eyebrows, eyes, nose, she's got labial folds, the facial, what's the name of that one fold, guys? Help me. These are labial folds.
Yeah, that's it.
Yeah, I had it. Right here, everything looks symmetrical. So what I'm gonna do, Jenna, this might be weird questions, and actually I would probably, for the sake of the camera, we'll have you just stay there. Do you feel like you can sit up in the bed?
Yeah.
Okay, let's do that. And I'm gonna sit just so I'm looking right at you. So I'm gonna ask you to do some weird stuff. We're just making sure that all the muscles and the nerves in your face work okay today, okay? So can you raise your eyebrows for me? Good, and can you blink? And can you puff your cheeks up? Okay, and can you smile and frown? Okay, good. Furrow your brow like you're mad. Okay, good. Good, it's really good. So, good. What are we checking if we're doing that, you guys? What would that be checking? What nerve? Facial nerve.
Facial nerves.
Number 7, right? Makes sense. It's on the face. Okay? So we've checked that all out. Now, I'm gonna grab some gloves and Jenna, I'm gonna be just feeling on your scalp just to make sure there's no bumps, no lesions, no scars. Have you ever had surgery on your head that there would be anything on the head?
No.
Okay, I'm just gonna go like this through the person's hair, and I'm feeling all around the head. And I don't feel any lumps or bumps. While I'm here, I'm gonna be just checking her sinuses. Why not, right? She's right here. Can you put your hair behind your ears, and then we can get a good look. Are you okay if I sit down? Okay. So then I'm just gonna, you tell me if anything is tender. Sometimes if people have sinus infections, it'll be kind of sore through here. So I'm just gonna kind of press. And we can count this as palpating the nose too, because we're in that same spot. I'm just gonna go around. Nothing's tender? Okay. And while I'm here, I don't know exactly what order we've got, but I'm just gonna go, I'm here already. So why not check for her TMJ or trimandibular joint, okay? I'm gonna have you open your mouth real big and down. Does that hurt at all?
No.
No. So I would be seeing if it's tender, feeling if, or hearing or feeling crepitus, which is where that kind of popping sound is with the trimandibular joint. And that's fine, I don't feel anything there. So I'm gonna keep going. And Jenna, what I'm gonna do next is I'm gonna palpate your lymph nodes, which are kind of like through in front of your ear and behind your ear, through your neck, and I'm gonna end right down here, okay? So you just tell me if anything is tender. We're doing preauricular to start, which is the front of the ear. We're gonna go down tonsillar here, posterior auricular, occipital our way in the back, moving our way along the jawline, submandibular in the front, anterior cervical in the front of the neck. A few other ones, there's 10 total. And then I would move down, normally you'd be like under the sweatshirt, and I'm gonna end right above the clavicle, which is be the supraclavicular, okay? So we've got all of those tested. I don't, normally in an adult, you wouldn't necessarily feel anything. If for some reason you would feel, you would make sure that they're not tender. We wouldn't want them to be tender. We would want them to be movable. If somebody had a respiratory infection, you might have swollen lymph nodes. But if they're harder and firm and sticking there and or in pain, that would not be a good thing for the patient, okay? So we did all of those, and we would be checking with the TMJ, that's nerve number what? 5, trigeminal, sound right? 5, trigeminal, okay. The other one that it'll also check, which is what the first thing checked, which was 7, facial, right? Which makes sense, it's part of the face as well. Okay, we felt all of that. I'm gonna try and assess the thyroid now. The thyroid has to, when we're assessing this, I'm gonna have Jenna swallow, and so we'd be looking at cranial nerve 9 glossopharyngeal. Correct me if I'm wrong on any of this stuff, because I don't want to say it wrong. Okay, glossopharyngeal. So, Jenna, I'm going to check your thyroid. So what that involves is there's a little gland that's like around your trachea here in your throat. I'm going to be behind you. I'm gently going to push on this side. I'm going to have you look forward and down a little to the right. And then I'm going to press your trachea over to your right a little, and I'm going to feel the other side of it with my right hand. I'm going to have you just swallow hard. Good. And I can feel the trachea. I can feel like the cords, the cartilage on the trachea. You shouldn't be able to feel like a lump on either side or both sides. You wouldn't be able to feel normally the thyroid. And yours was great. I don't feel anything, so that's good. That all tested out, which again, checking glossopharyngeal. Since we're here, I'm just gonna assess her neck range of motion, okay? Have you ever had any injury, Jenna, in your neck or any surgery in your neck?
No.
Okay. Can I have you look to the left and then to the right? Good. And tip your head forward, your chin forward, and then tilt it back. Good. And then just kind of roll your head around. Good. And then just to test the strength of your neck, I'm going to put my hand here and you're going to push against it, okay? Okay, try and press to your left. Great. And then try and press to your right. Good. And while we're here, I'm going to do the same thing with your shoulders. So can you push your shoulders up against me? Good. And I'm pushing down. Good. So we'd be checking and doing that, would be assessing the neck muscles, and that would be checking the accessory nerve, okay? Accessory nerve, also known as the spinal nerve, which is number 11. Good, okay. So that's everything that we've done through that first section. Now we're gonna move into eyes and ears. So I'm not really doing a lot of touching now. I'm gonna take that off, put that in the garbage. We'll do some more hand hygiene, okay? Got that. So Jenna, now we're gonna do a couple tests to check your eyes. I'm first gonna just look in your eyes. I can see that the sclera is nice and clear. The conjunctiva is nice and clear. It's not milky looking, it's not pink. It doesn't look like there's drainage in the eyes. Are you having any itching or any pain? Okay, your eyes look the same on both sides. There's no ptosis, which would be like drooping eyes. I don't see the word that I already forgot that meant your eyes crossing. You guys, we said
Strabismus.
strabismus. Thank you. Yes, perfect. It's a good thing you and I are here. Good, we got that, good. Okay, so looking at the pupil size, everything looks good. We are going to then assess for something called PERLA, which is P-E-R-R-L-A, which is that your pupils are equal. So when I look at them, they look the same size, that they're round, which they are, and that they're going to react to my pen light and accommodate, which means I'm going to take this pen light and I'm going to come from the side and look at your eyes, and they'll just constrict. Meiosis, am I right on that? And then word for the pupils constrict. And they should constrict at the same rate on both sides. And I should be able to kind of hold this up and see what your pupil size are. They should be between 3 and 5. I'm going to say they're 3 to 5 millimeters. And they're the same on both sides. Good. So I'm going to have you just look straight ahead. The nerve that we're checking is the ocular motor for this, which is number 3, I believe. This is kind of faint, but we'll try and do it. So you just look straight at me, and I'm just going to make sure that your pupils constrict. And they do. Maybe I'll have you go this way so that Jen can get you more. I'd want to be right in front of her though. Good. So they both are constricting at the same rate. They look equal. So we would say she's got PERLA. Okay. last one, well, I'd want to add this to it too. So I'm gonna make sure, I'm gonna bring my finger to your nose. You don't move your head, just watch my finger with your eyes, okay? And they should look like they're crossing when they get closer. Good. So that means they're accommodating. They can see things farther away and then they adjust to see things closer. So she's got Perla, Perla's intact, everything is good with that. And again, that was ocular motor, nerve number 3. The weird test a little bit is the confrontation test. So that one is going to be checking your peripheral vision. So Jen, I'm going to have you swing your legs this way. We're going to sit kind of close. You're going to cover one of your eyes with your hand, whichever one. And I'm going to cover right across from that, okay? And I'm going to take my fingers. It's hard because you have to be like kind of close. We could be standing doing this too. And when you see my fingers come in your view, just say now, okay? You just look, okay.
No.
Okay.
No.
Are you blind? No.
No.
Okay, let's do the other one. And again.
No.
Okay.
No.
And usually when I do this, I do all 4, but Jasmine saw them right away, so.
I see it.
Okay, so you probably can see it on that side, but I would say do all 4 on each side. They probably will see it immediately if they don't have anything blocking it. So we would say that confrontation, she passed the confrontation test. And when I was guessing on this one, I'm guessing it's more like the optic nerve because she's really looking at her vision, just like when the Snellen test tests her vision, which is actually next. So the Snellen test is like what you do at the eye doctor, Jenna, and checks your optic nerve, which is number 2. It's just assessing your vision. So I'm going to have you try and read for me. You're going to hold this about 14 inches away from you. If we were doing a real wall one, we would go like 20 feet away. And I'm going to have you read the line that you feel you can get correctly. I'm just going to watch with you too, where you and you cover one eye. We'll cover, so this is your right eye.
Okay, the bottom. 4, 2, 6, 7, 3, 9.
So there's only one problem with this is that your teacher can't see as well as you can because I don't have my reading glasses on. So I would have to have my correct glasses on. That's the one you can see. Yeah. Okay, so now let's try and, what line was that?
The bottom one.
Okay, so that was 20/20. Perfect. Now let's try your other eye. Same, try that line or a higher line.
I mean, I already know what it is.
Let's go like this then. Is there one on this side?
Read it backwards. Oh yeah, I can read it backwards.
Try and do that, yeah. I thought they had a different one.
9, 3, 7, 6, 2, 4.
Okay, wonderful. So then we would say it's 20/20. So she's gonna cover one eye, read it, cover another eye and read it. When would I have to have you go up if you made how many mistakes?
2 or more.
Yeah, so if you made 2 or more, we'll have them read the line one up from that. If they do that perfectly or one wrong, we'll say that's the one that they would have. So her vision would be 20/20 in bilateral eyes, okay? And again, that's optic nerve number 2. And now we're going to be assessing 3 different nerves, Jenna. This is going to be how well your eyes can follow my finger. It's called either the extraocular movement or the following the cardinal signs of gaze. So you're going to look at me and you're just going to follow my finger with your eyes, okay? So I'm going to go in each corner. There's going to be 3 on each side and come back to the middle. We always start at the middle. We go up to the side and then down, and then we're going to do the other side. Up, over, and down. Good. So that one tests 3 different nerves. Ocular motor is one of them, which makes sense. Eyes moving, ocular motor. Her eyes were able to move. That's number 3. Trochlear, which is number 4. And the third one is abducens, which is number 6. So that's the one that has the most nerves tied to it. Okay, all done with the eyes. Now we've got the ears. And I think we can probably just have you stay sitting. I'm going to take a look at your ears. If you can, do you have a haircut by chance to pull your hair back? Or
I
if you
don't.
don't, okay, we'll just have them behind your ears. So I'm just looking at the ears. They look symmetrical. So that's all good. I'm going to see if she has any drainage or any wax buildup in the ear. And I'm going to pull the pinna up and back. The pinna is the top part of the ear, okay? Let's see if you guys can see here. Normally would not be, sorry. I'm going to pull, I'd be over to the side normally, but we're going to be up and back. And then I'm going to look in. And yep, everything looks good. I don't see any drainage. I don't see any redness or swelling. And is up and back, everything looks good, okay? Great, so we did that. While I'm here, I'm gonna palpate too around the ears. And again, this was mostly when we talked about people being on oxygen. It's the tubing is gonna irritate the ears. So you're really looking at the tops of the ears here. You're feeling to make sure that nothing is painful. The tragus, that's this part right here. And then you would typically go behind the person too and look, because that's sometimes where tubing can break down the skin right behind the ear. And I'm not seeing anything. Everything feels normal when I'm touching. So we've got that. And then the last thing I would do would be to do the whisper test, which checks vestibulocochlear 8. I hope that was the right number. So Jenna, I'm gonna say 3 words. You're gonna cover this ear. I'm gonna whisper 3 words and you tell me what those 3 words are.
South Sunshine Anthony.
Okay, great. Now let's try this one.
North Banana, Atlanta.
Wonderful. Yeah, all those words. So if she got 3 right on both sides, that's all I asked. She got 100%, so we'd say she passed the whisper test. Okay? Trying to think if I need to touch anything else. We're moving on to the nose, which we already palpated your nose. Already palpated everything else, I think. So then again, we can take the gloves off. I would do hand hygiene again. So the other thing that we're going to check is your ability to smell, Jenna. So I'm going to have you put your finger over one side of your nose, so one side of your one nostril, and I'll have you close your eyes, and then I'm going to have you tell me what smell I'm putting under your nose, and I'll tell you when it's there, okay? Okay, now try and take a whiff.
Alcohol wipe.
Oh, okay, now, sorry. Shove it right up there. Now let's try the other side, okay?
Alcohol wipe.
Oh, you thought I was gonna trick you. Nice, you got both. So you might do something different, but the patient might also expect you to do something different. So you can do the same. We could use lemon. I can try and bring some of that in, or coffee. So we're testing that. So the nerve number 1 is the olfactory nerve. So we'll say that we assess that. It's great. She can smell everything that she's supposed to be smelling. So we'll move on to mouth and throat. So we're going to be looking at, we already looked at everything in the face. What I really want to do, I can use a pen light here too. I would have gloves on normally, so I'm just gonna, I'll put it back there just in case. I'm not gonna really use the tongue depressor, but normally you would have that because I'd be touching this in your mouth, so. So we won't have to do it on a partner, but normally you would take the tongue depressor, you put it gently on a patient's tongue. You don't want to totally, I mean, sometimes you'll put it back to see if you can get their gag reflex as well, but we would say, I'm just gonna have you open your mouth and say ah and stick your tongue out for me. Good. So we could press down if we couldn't see very well. We can also use this to like look in the sides of the mouth to kind of look on the inside of the buccal mucosa where the sides of the cheek are. I'm gonna have to do it one more time for me. You have no tonsils, am I right?
I
don't
do.
see them. Where are they?
I should.
Oh, got it. And the uvula is midline, so you have that thing dangling in the middle. It's going up when I'm looking, so when you say ah, it should be midline. You say if you can see tonsils or not, if there's any swelling or not. The other things we talked about would see like, I'm gonna have you lift your tongue up and down too, like that. Yeah, so we don't see any sores or redness. There's no signs of white stuff like it would be thrush in the mouth. I'd look on the sides of the mouth to see if there were any patches of white patchiness there from thrush or sores. See if there's any bleeding gums, any broken teeth, any missing teeth. Does she have dentures? All the kind of things associated with something that you'd see in the mouth. Is there foul odor from the mouth? Because sometimes that can happen if the person has infection in the teeth or has some kind of an illness or has an upper respiratory infection or not great hygiene. All of those things could happen. So when we're doing that and having the person stick their tongue out and say ah, using the tongue depressor, that is checking the glossopharyngeal, which is 9. It's also checking the vagus nerve, which is 10, and the hypoglossal nerve, which is 12. We're doing hand hygiene here. Good. So the last part of the test, Jen, is going to be musculoskeletal. So we're going to see how strong your muscles are and how good your reflexes are and how good your balance is, okay? So we'll start by having you just simply, I'm gonna have you walk to the sink, just normal walking for me if you can. Okay, good. So I don't see any ataxia. She doesn't look like she's shuffling like someone with Parkinson's would. She doesn't have any one-sided weakness like someone with a stroke would. Everything looks effortless and coordinated. Now when you come back, Jenna, I'm gonna have you do what's called heel to toe walking like they would for like if you got pulled over by the police. But I want you to look straight ahead, not at your feet, and then just come to the edge of the bed when you're walking. Heel to toe. Good. And you had only 3 drinks before class, right?
Oh my
so that's perfect. Okay, good. So that looks okay. Okay, good. We've got that. Before you sit down, while I've got you here, so that one check is checking 8 vestibular cochlear. Vestibular, like that's your balance, cochlear is your ear. Those things are all connected, so that we're assessing that. So the next test I'm going to do is called a Romberg test, and it's really checking your balance as well. What I want you to do when I tell you to is I'm eventually going to have you back up against the bed. This is checking again your vestibular cochlear. I'm going to be here, so in case you're feeling woozy at all, I can make sure that I catch you. You're going to look ahead, and I'm going to count. We're going to say it's 20 seconds. I'm going to have you close your eyes and just stand still, okay? So we would do this for 20 seconds. I'm just kind of waiting here in case she needs anything. We'll say 20 seconds pass, you can open your eyes. So her Romberg test was negative, meaning her balance is good. She's able to stay balanced while her eyes are closed, okay? Good. And again, that was number 8, vestibular cochlear. The other name for that is acoustic. So both of those can be used. Now, I think we can have you sit for everything else. I'm gonna see how well your nerves are at picking up different sensations. So I have something that is, I'm gonna use something that's either hard or soft, or we can use dull or sharp, okay? So while you're looking, this is what it's gonna feel like, just so you can tell.
Okay.
There's the hard, and here's the soft,
Okay.
okay? So I'm gonna have you close your eyes, and I'm just gonna touch different parts of your body with one or the other, and you tell me which one you feel, okay? Okay. And here we go.
Hard.
Okay,
Soft.
okay,
Soft. Hard. Hard. Hard.
okay. And then if she had her pants pulled up, then we would try and do the same thing on each limb. We'd do soft or hard in just a random pattern, okay? She'd be checking each of those. And as long as she could say all that, then we know that her sensations are intact throughout. We'd want to do each limb, upper and lower, and the face as well. So when we're doing that sensory test, we have down on the sheet trigeminal. Could be some other ones in addition to that, but so we're making sure that we touch the face because this is where the trigeminal nerve is. And I can double check to see if there are other ones associated. We're gonna check your reflexes and then your muscle strength, okay? And then we're all done for the day. You've been a great patient. The reflexes, we can either do the patellar or the bicep. It would be hard for Jenna on this bed to do the patellar because her legs are on the ground. So we need the leg to dangle. We need either of the limbs just to be as loose as they can. So if you're going to choose to do the patellar, should be in the book too. I think I'm gonna have you, I'm sorry, I said patellar and I meant bicep, sorry. I can see why you did that. Right here, and I'm gonna have you just relax there. And you're going to want the person to flex so that you can feel their bicep tendon, which yours is right here. And then ideally, I'm grabbing pretty hard around there. Now you relax, I'm gonna put my thumb right on there. There's no guarantee this is gonna work, but then you kind of hit your thumb. And you might see a twitch. Oop, I can feel that, but I can't see it very well. There. So you guys can't see her middle finger. She's giving me the middle finger. That's a good way to do it, Jenna. Yeah, so that middle finger is twitching. So I would do that on both of the arms, or if you chose to do patellar.
It is dangling now.
Okay, dangling a little bit here. You would want to kind of grab onto the quadricep muscles and you're just, does this feel okay?
Mm-hmm.
Okay. You're just going a little bit below, you're hitting that patellar tendon, which is just below the knee. I don't think I could get it on you before, could I? There, it moves a little bit. And you might note, so this one moved a little bit more than this one. You could say that she had like +2 reflexes in the left patella, +1 in the right. That was it. So we're checking, you could do either or. You can pick one or the other. And then we're going to be inspecting all the joints. We have on the sheet, we're looking at pain, pulse, pallor, paresthesia, paralysis. So as I'm feeling her joints, like her shoulders, elbows, wrists, hips, knees, ankles, are you having any pain in any of your joints?
Mm-mm.
Okay, is there any numbness or tingling?
No.
Okay, and any paralysis where you can't move a certain joint to your knowledge? Okay, so we've got all that down. We would try and feel it, obviously, for warmth and whatnot. So if they had sleeves, if they had short sleeves, we'd be able to do that with some of the joints. So what I'm gonna do is we're just gonna check your muscles. We checked your shoulders already, and they seem to be pretty strong. Everything was good. You were able to push against resistance. So I want to do the same thing in checking your range of motion for your elbows, your wrists, your hips, your knees, and your ankles, and then see how strong they are, okay? So can you put your arms out like this, okay, and down, and I'm gonna have you roll your shoulders forward and roll your shoulders backward. We already know they're strong enough. Flex your elbows and extend your elbows, good. And I'm going to have you circumduct your wrists and then other way, good, and then your hands, wrists up and down. So let's see if you can go against me when I'm pulling on things. So have your arms like this. I'm gonna put my hands in here and you're just gonna pull towards you. Good. Oops. Try not to do this on a rolly chair. And then I'm gonna have you push against me. Good. So her upper body is strong. With your hands, I'm gonna have your hands like this. I'm gonna put my hands on top. You're gonna try and move your hands upward like this. Good. And then you're gonna try and do the same, pressing down. Good. So she's got normal strength. We would call that +5, so she can go active all the way against my resistance. I'm gonna do the strength down here, and then at the end, I'll have you just lay in the bed and try and have your hip go out. But your knees are already bent, so we know that you have proper flexion with your knees. Can you make your legs go out like this? Both of them can. How about your ankles? Rolling out and rolling in. And then dorsiflex, so tip your feet up, and then point your toes out. That's plantar flexion. Good. I'm gonna come down here and I'm gonna have you pull your legs back towards you, and I'm gonna grab your calves. So you pull toward, good, and then now push against me, good. And then I'm gonna have you try and push your feet up, great. And then pretend you're driving a car and push the gas pedal down, good, okay. And then the last thing is I'll have you lay in the bed, and I would normally, I guess, have this flat, and just see if you can move your leg out like this. That would tell me that your hip is moving, good. And then try the other one, good. So I think we've gone through all the joints. Everything I'd say would be a muscle strength range of motion of 5, because she was actively able to do it against my resistance. The last thing I would want to do would just be to have you repeat the 3 items that we said at the beginning. Do you remember those words?
Jacket, swimsuit, banana.
Yes.
Really?
You do not have a stroke. You are great. Long-term and short-term memory, and everything was good. So then I would say, that was great, Jenna. You did wonderful. Everything is healthy. I would lower the bed. I would give her the call light. I would go wash hands, ask her if she needed anything else, and then we should be all done. Did I miss anything before we stop recording? No. Okay. And you and I both need a curtsy, and we're done. Okay.